like most women, I thought of food as simply a way to control my weight. I never thought about it, how it might affect brain health. We didn't talk about nutrition in 4 years of psychiatry residency training. We didn't talk about food once, not even when we were talking about eating disorders. And so it was really remarkable, that blind spot. So what I did was I just kind of dove into the science, all the primary literature, the scientific articles, and started reading widely across a variety of disciplines, uh, botany, anthropology, psychiatry, toxicology, animal husbandry, everything I could get my hands on. Try to, I came across, for example, a paper in 1965 that had been published about 10 women who had been with schizophrenia, who had been in the hospital setting, placed on a ketogenic diet for a brief period of time. And the clinicians there did notice that their schizophrenia symptoms improved. And I came across information in the literature about how bipolar disorder and epilepsy are so similar. We use many of the same medications are used to stabilize seizure activity. Those very same medicines are, in many cases, used to stabilize mood in people with bipolar disorder. And so it turns out that there are actually many, many similarities between bipolar disorder and epilepsy. And I thought, well, we've known for well now over 100 years now that that ketogenic diets have the ability to essentially stop seizures in their tracks for many, many people. And that's powerful evidence that this is a brain stabilizing diet. This diet stabilizes brain chemistry. And if that's the case, shouldn't it also be the case, or could it potentially also be the case, that would stabilize brain chemistry for people with mood swings? And the more experience you get, the more you see the power of these diets. I mean, when you use these in clinical practice, there's nothing else that works as well as the ketogenic diet. And not just better in most cases than medications alone, or even than medications at all, but with many, many fewer side effects. Whatever side effects you're going to see are usually very temporary, short-lived, just a few weeks often, and tremendous number of what I like to call side benefits. Metabolic health and overall physical health improve. But the ketogenic diet is not necessarily a weight loss diet. You can formulate the diet to be weight neutral, constructing the diet so that the majority of the ketones that are being produced inside your body are coming from food as opposed to from your body fat. So you can do that. And I have had some normal weight patients and even some slightly underweight patients and some very physically fit patients, very athletic patients who did not need to lose any weight, adopt this diet and experience remarkable improvements in their mental health. The weight loss as a benefit, but not necessarily the goal. The diets that had historically been used to treat pediatric epilepsy, especially early on, were very restrictive with respect to protein. And so they were extremely high fat diets, about 90% fat, and in many cases, about 6% protein. Far too little protein. Yeah, just too little protein to be healthy, especially for growth. Three of the major driving forces underlying neuropsychiatric illnesses are inflammation, oxidative stress, and insulin resistance. You're going to see problems throughout the body, the brain, and in the rest of the body, including in the gut is the first line of defense. If you're eating the wrong way, the gut is going to be the first to experience the impact of that. And that can be anything from foods that are physically irritating, mechanically irritating to the gut, that really are, were never really meant for human consumption, things like grains and legumes and certain types of seeds, and all the way to foods that are very difficult to digest, and foods that cause inflammation, and even contain certain toxins. So there are some plant foods that can naturally contain toxins which are damaging to our cells. And so the gut will be the first. That's your first line of defense. Your gut will be the first to experience the effects of an unhealthy diet. What I should say is that if you have gut health problems, one of the places to look for problems is the amount and type of fiber in your diet. And often the recommendation is to increase the amount and type of fiber in your diet. And there's actually no science to support that whatsoever. there are a few studies that show us that actually, if you do the opposite, if you reduce the amount of fiber in your diet and you ate a diet that is easier to digest, because fiber is by definition indigestible. So it makes sense then, stands to reason that if you eat too much fiber, you might actually suffer from indigestion. There really isn't a one size fits all diet. And this is coming back to your CGM point. One of the ways that I like to use CGMs is to help, again, sort of foster curiosity about metabolism. And people love to know, what's going on inside of themselves. It gives you a real window into how your body's working. Oatmeal in particular can have a really profound impact on blood sugar, even if it's steel cut oats, which is supposed to be so good for us. And we are here all the time that oatmeal is a brain healthy superfood. This is, have your bowl of oatmeal, your steel cut oats with the blueberries on top, and that's going to be really set you up for good brain health. And of course, nothing could be further from the truth. And I include in the book actually CGM tracing of someone who's kind enough to share their data publicly, what the CGM looks like with different types of oatmeal, and how she actually needed to remove all oatmeal from her diet in order to stabilize her mood. And it's these types of kind of curiosity experiments that I think really empower people to take control over their own brain health, instead of thinking, well, I'm having panic attacks or hypoglycemic episodes, or I'm just feeling unstable out of the blue. Rather than thinking that they need medication, they could first, at least, unless they're in a crisis situation, medications can be very useful. Why not start with food first? Why not look there first? Because 9 times out of 10, you'll be able to help yourself feel so much better. And the CGMs are really game changers when it comes to people really being able to see that connection between what they're eating and how they're feeling. Fasting insulin is one of the most helpful laboratory tests a person can order. What you really want to see, ideally, is you want to see a fasting insulin of, say, 6 or below. I mean, I always say to people, at least we'd like to see your fasting insulin in single digits, and 6 or below is really ideal. But I would routinely see in young women, these are 18, 19, 20-year-old people, insulins in the 20s and 30s, fasting insulin routinely. And of course, if you lower your carbohydrate intake, because carbohydrate is the macronutrient that spikes insulin the most, has the biggest effect on insulin. It's not that it's the only thing that affects insulin, but it affects insulin the most. If you lower your carbohydrate intake, that will drop your insulin. And it's really effective and really predictable response. And you can change it in just a matter of weeks. And the same with triglycerides. So triglycerides, which are part of the standard cholesterol panel, they almost always drop like a stone on a low carbohydrate diet. You can see people's triglycerides drop by hundreds of points in just a few weeks by reducing, by getting their carbohydrate intake under control and a ketogenic diet very, very reliably. Not in every single case, but in nearly every single case will drop those triglycerides. And that's that's really, really good news for your cardiovascular health.
The question you posed, can eating a ketogenic diet improve symptoms of serious mental illness? And this included 31 patients. Bipolar, there was 12 of them, major depression, schizophrenia. You describe a ketogenic diet, 75 to 80% fat, 15 to 20% protein, 5% carbohydrates. Symptoms improved in 100% of patients. 43% achieved clinical remission. 96% of patients lost weight. And 64% of patients were discharged on less medication.
With serious chronic mental illnesses. And he's been working with some of these patients for decades. And what I found, so many remarkable things I find about his work. The reason why he decided to ask 31 of his patients who had what's called treatment-resistant mental illness, the reason why he asked them to come into the hospital and try a ketogenic diet is because they were not responding to all of the different types of ways that he had tried to help them with medications and psychotherapy and support, and even repeated hospitalizations, and in some cases even electroconvulsive therapy or ECT in the past. So he had witnessed a young family member of his and his extended family with epilepsy and autism respond beautifully to a ketogenic diet within just a few weeks of having started it. I wonder if this diet seems to be good for the brain. I wonder if this diet could help my patients. I have nothing left to offer them except my ongoing support. And so these folks who trusted him, they came into the hospital, and they stayed in some cases for very long periods of time. In any case, he put them on a ketogenic diet in the hospital setting. This has never been done before in any kind of a sort of organized or systematic way, and all of them improved. There were 3 people who weren't able to stick with the diet for more than a couple of weeks, and so we didn't analyze that information because they didn't stay on it long enough. But 28 out of 31 did stay on the diet, and everyone improved. And I want to just reiterate what you said: 43% of these patients achieved clinical remission. That you do not see that with conventional psychiatric care, and especially without increasing medications. He put all of the patients on the same diet. And the reason he did that was because he's not a researcher, he's a clinician. He was simply trying to help his patients and seeing what would happen. And we published, this is what it's called, a retrospective study. We published the outcomes after the fact because they were so noteworthy. And we just thought they deserved to be shared. And so that hopefully will help people, inspire people to do more rigorous research, which I think it has done.